Hello, I'm Dr. Brent Gibson, and I want to give you an opinion here today. Uh, a lot of people are being given the diagnosis of idiopathic peripheral neuropathy. So the truth is, you need to understand what idiopathic means. Idiopathic basically means that you have a disease or condition which arises spontaneously or for which the cause is unknown. So if you have an idiopathic peripheral neuropathy, that means there isn't a cause, you don't know what happened, and it all of a sudden just appeared. Now, my opinion of idiopathic peripheral neuropathy is that it's a very, very small percentage of individuals that really have this, if any. It's a diagnosis that's way overused. It's a diagnosis that's used because you don't have the usual presentation or you don't have the usual causes that they're looking for. Now, what you need to understand is there's 150 different causes of peripheral neuropathy. These are all known causes. These are all diagnosable causes where you can actually do tests and evaluations and get the determination that this is the cause of your peripheral neuropathy. And so to this point, I've been treating peripheral neuropathy for close to, I guess, over 20 years. And in doing that, so far, I have found 0 individuals that have a true idiopathic peripheral neuropathy. We were always able to find at least one cause, at least one reason why they're having those symptoms, why they're having the peripheral neuropathy. And because of that, I don't usually use the term idiopathic peripheral neuropathy. Instead, I use the correct term. Maybe it's a deficiency neuropathy. Maybe it's a diabetic peripheral neuropathy. Maybe it's a compression peripheral neuropathy, or a vitamin dependency peripheral neuropathy, or a toxic neuropathy from a medication or an antibiotic or alcohol. The idea is there's usually, actually so far, in all cases that I've treated, all cases that I've seen, we're able to find a cause, at least one. In most cases, there's multiple. And in all cases, that means there's things that you can do to treat your peripheral neuropathy. So when I don't give you the diagnosis of idiopathic peripheral neuropathy, that's because I believe, and so far have been proven correct in this, I believe that every individual has some cause that can be found if you do the right tests, if you do the right evaluations. And because of that, we're not giving you this diagnosis. So I'm putting this here to make sure individuals know that idiopathic peripheral neuropathy is real. It does exist. I'm still looking for my first case of true idiopathic peripheral neuropathy where I cannot find a cause. So thank you. Have a great rest of your day. Hopefully this will help you in determining what the causes are of your peripheral neuropathy.